Imagine living in a country where no public schools exist. If you want your child to get an education, you have to pay for it yourself. Now, maybe your employer pays for part and leaves you with the rest of the bill. And let's imagine that the tuition at your child's school is so expensive that it takes up to 16% of your weekly paycheck. Well, this scenario sounds ridiculous, but if you substitute the words health coverage for public schools, you would be describing the current healthcare crisis that we are experiencing in the United States. According to the Institute of Medicine of the National Academy of the Sciences, the United States is the only wealthy industrialized nation that does not have a universal healthcare system. There are currently over 47 million uninsured Americans in this country. And just as we value public education as a right for every citizen, we must also make guaranteed health coverage a reality for the millions of uninsured and underinsured Americans. Today I will show you how we can accomplish this goal. First, I will discuss the problems with America's healthcare system by sharing statistics and stories about the current state of healthcare in this country. And then I will offer a plan which details how we can provide universal health coverage to every American. But let's start with the problems. Healthcare costs are so expensive that the United States spends over 16% of its GDP every year. That's twice as much as any other country, according to the National Center for Health Statistics. The United States is represented here in the orange. Now, where does this money go? Well, profits for the 10 largest insurance companies increased 250% between 2000 and 2009, which is 10 times faster than inflation. This is according to a report from healthreform.gov. And the top 5 health insurance companies took in a combined profits of $12.2 billion in 2009, which is up by 56% over 2008. Only 46% of small businesses, who employ half of all private sector employees, this is according to the Small Business Administration, offer health insurance to their employees. 75% of these companies say that the reason for this is because of the cost of the insurance. An example is Jennifer from California. She was 29 when she was diagnosed with hypothyroidism. Now, hypothyroidism is easily treatable, and it was paid for by her current health insurance policy, which is covered by her employer. The problem is, she would like to switch jobs and take a job with a small business owner who does not provide insurance. Jennifer can't qualify for an individual policy due to her hypothyroidism, so she's stuck at her current job. Also, according to the Kaiser Family Foundation, in the last 10 years, health insurance premiums have increased 131%. Families simply cannot afford these rate increases. I sent a survey out to the students of my public speaking class, and the results that I got back surprised me. 50% of my classmates have gone without medical coverage, either a doctor's visits or prescription, because they could not afford them. And HealthPacOnline.net reports that almost half of the bankruptcy filings in the United States are due to medical expenses. Also, uninsured people are less likely to get preventive care for such chronic diseases like diabetes. Now, take Janice Ramsey, for example. She was self-employed and she had to buy her own insurance, but no one would cover her because she had diabetes. Jonathan Cohn talked about her story in his book, Sick, The Untold Story of America's Healthcare Crisis and the People Who Pay the Price. He quotes her as saying, "Every 3 months you're supposed to go for blood work to see where your diabetes is at. I go twice a year because it's $400 each time you go, and nobody can pay for that." So healthcare is expensive, and the price does not equal good results for Americans. As you can see from this slide, the United States is 43rd in lowest infant mortality rate, and we rank 47th in life expectancy. These aren't exactly the best results for the amount of money that we spend. So what is the solution? Well, I propose that universal health care will solve the problem of un- and underinsured Americans by providing guaranteed affordable health coverage to every citizen. What do we mean by the term universal health care? Well, there are different variations and definitions, but the version that I propose is a single-payer, fee-for-service system where all Americans are covered for any medically necessary service. The single-payer system basically just refers to the fact that one agency does all the paperwork and pays all of the claims for someone. The Physicians for a National Health Program, otherwise known as the PNHP, reports that 31% of every healthcare dollar in this country is spent towards administrative cost. So the single-payer system would help reduce those costs. Now, in a fee-for-service plan, doctors and hospitals are not employees of the government. They stay private and they're reimbursed by the government through this single-payer system. So it is not socialized medicine, and your doctor still makes all the decisions about your medical care. Now, universal health care could be completely paid for by a couple of new taxes. Employers would pay a 7% payroll tax for each employee, which is pretty much less than what they pay for private health insurance. And employees would be responsible for a 2% income tax, which would typically be less than the amount that they pay for premiums, co-pays, and other out-of-pocket expenses. The universal health care does eliminate private health care or private health insurance companies. But does this mean that we eliminate a lot of jobs? Well, in the plan recommended by the PNHP, a lot of the administrative work would go to people who would then work for the single-payer system. And then a lot of the other jobs would go to people who would work in the fields of home health care and public health. And finally, providing universal health care is a moral issue. Uwe Reinhardt is a Princeton University professor of economics, and he gave an interview with National Public Radio. And in this interview, he said, "The issue of universal health care is not a matter of economics. Little more than 1% of GDP assigned to health could cover all. It is a matter of soul." So, not providing health coverage to all Americans is not just costing us financially, but it is also contributing to the moral decay of our country. So, as we have seen, universal health care is a feasible, moral, affordable solution to our healthcare crisis. And it is time for the United States to join the rest of the wealthy, industrialized nations who view healthcare as a right and not a privilege. I told you the stories about Jennifer and Janice, and now I want to tell you another true story about me. A little over a month ago, I was hospitalized and had to have emergency surgery for a bowel obstruction. So far, my bills total over $50,000. But I have very good insurance through my husband's employer, so I don't have to worry about filing bankruptcy or going without medication. But why does my story end so much better than other Americans? Why? Because I was lucky. But our medical care should not depend on luck. It should be a right that's afforded to everyone. Now, last year, Congress passed the Affordable Care Act, and it is a beginning to the health care reform, but it's not the whole story. If you agree with me that everyone has the right to health care, please write or call your congressional representative or your senator. And I have a copy of a letter that you can send here today that you can model yours after. I thank you for listening, and please know that our individual acts will help millions of Americans to get the health care that they need and they deserve. Thank you.